Hello, learners. Welcome to Lecture 22, the final session of Module 3 on Public Health Policies and Programs for Reproductive and Child Health. In the past lectures, we have studied the policies, strategies, partnerships, and monitoring mechanisms, challenges shaping RCH services and service delivery. Today, we look ahead to the future. Emerging demographic, epidemiological, technological, and social changes are transforming the landscape of reproductive and child health. Understanding these trends is crucial for designing realities and resilient and responsive programs. This lecture will review the major issues on the horizon and outline future directions that policymakers, practitioners, and researchers must take into account for consideration to ensure a sustainable improvement in maternal, newborn, child, and adolescent health. The context in which RCH operates today is very different from when programs were first designed. Health transitions, urbanization, climate change, new diseases, and technology are reshaping the priorities. To remain relevant, RCH programs cannot be static, they must evolve with the times. Emerging issues like adolescent health, infertility, mental health, and gender equity require sustained attention. Future planning is not about predicting with certainty, but about preparing flexible systems that can respond to shifting needs. This requires foresight, innovation, and willingness to learn from both the successes and the failures. Demographic change is one of the most important forces shaping the future of RCH. Fertility rates are declining in many states, bringing India closer to replacement level fertility. This means that while maternal and child health remains important, attention must also shift towards aging populations and non communicable diseases. At the same time, India continues to experience a large youth bulge, which presents opportunities for demographic dividend but also challenges in education, employment, and health. RCH programs must balance the need of mothers and children with the broader demographic realities. Epidemiological transition is changing the health priorities of families. While infectious diseases still claim lives, particularly among children, non communicable diseases such as diabetes, hypertension, and cardiovascular disorders are becoming more common among women of reproductive age group. This creates complex scenarios during pregnancy and comorbidities increase risks. The coexistence of infectious and non communicable diseases means programs must prepare for a double burden of disease, which caters to both communicable and non communicable diseases at the same time. For child health, malnutrition coexists with obesity in some areas, reflecting nutritional transitions. For child health, malnutrition coexists with obesity in some areas, reflecting nutritional transitions. These shifts demand new approaches that integrate prevention and treatment across disease categories. Climate change is emerging as a critical determinant of reproductive and child health. Pregnant women are particularly vulnerable to heat stress, which can lead to preterm births and complications. Rising temperatures and changing rainfall patterns expand the habitat of vectors like mosquitoes, increasing the risk of diseases such as malaria, dengue, and Zika virus, all of which are a threat to maternal and child health. Extreme weather events such as floods and cyclones disrupt health services, destroy the infrastructure, and displace populations. Incorporating climate resilience into RCH planning is essential for future readiness. Urbanization is rapidly changing the landscape of health needs. While cities offer better healthcare facilities, they also create sprawling slums where millions live in poor sanitary conditions with limited access to health services. Migrant workers and their families are often excluded from the formal care systems due to lack of documentation and awareness. Urban public health facilities are overcrowded and overstretched, limiting their ability to provide quality RCH services. As urbanization accelerates, future RCH programs must develop models that specifically address the unique needs of urban poor and migrant populations. Technology is a powerful enabler for the future of reproductive and child health. Telemedicine and mobile applications can extend care to remote areas, connecting women and children with skilled providers. Digital health records improve continuity of care and reduce errors. Data analytics, including artificial intelligence, allow for real time monitoring and predictive modeling, helping policymakers target interventions more effectively. However, challenges such as digital literacy, internet connectivity, and privacy concerns must be addressed. Harnessing technology thoughtfully can make RCH services more accessible, more efficient, and more people centered. Adolescents are the future parents and workers of the society. And investing in their health is investing in the nation's future, in the nation's economy. So, adolescent sexual and reproductive health remains neglected with limited access to information and services. Now, comprehensive sexuality education is still contested, but is essential for empowering young people. Mental health issues among adolescents are on the rise, driven by academic pressure, social changes, and exposure to digital environments. Future RCH programs must expand their scope to provide adolescent friendly, holistic services that address physical, reproductive, and mental health together. While family planning remains important, infertility is an emerging issue affecting many couples. Lifestyle factors, delayed marriages, and environmental exposures are contributing to rising infertility rates. Assisted reproductive technologies, including IVF, are increasingly sought after. This raises issues like affordability, access, and ethical regulation. RCH programs must broaden their scope to address infertility as a part of reproductive health, ensuring that couples are supported with counseling, affordable services, and clear ethical frameworks. Ignoring this issue risks leaving an important group of reproductive age individuals underserved. Mental health has long been neglected in RCH, but evidence shows it is crucial for well being. Maternal mental health issues such as anxiety and depression affect a significant proportion of women during and after pregnancy, with postpartum depression being a common but under recognized condition. Adolescents too face rising mental health challenges, including depression, anxiety, and risk taking behaviors. Stigma and lack of trained providers prevent many from accessing care. Future RCH programs must integrate mental health screening, counseling, and support into routine services to provide holistic care. Gender inequalities they continue to shape reproductive and child health outcomes. Women often have limited autonomy in decisions about their own health, including whether to seek care or use contraceptives. Social determinants such as education, income, and cultural norms reinforce these disparities. Addressing them requires not only health interventions but also broader empowerment strategies. Improving girls' education, promoting gender equality in households, and encouraging men's involvement in reproductive health. The future of RCH lies in creating an enabling environment where women are empowered to make informed choices. Marginalized groups often remain invisible in mainstream. RCH programs and populations such as tribal populations face geographical isolation and cultural barriers, leading to poor health indicators. Migrant and minority groups they frequently lack documentation or encounter discrimination in provision of services. People with disabilities, especially women, experience compounded barriers to reproductive health services. Future directions must include targeted strategies to ensure equity and inclusiveness. Without focusing on the needs of the most disadvantaged, national averages may improve, but inequalities will deepen, undermining the goal of universal health coverage. Expanding coverage has been a priority, but the future demands a shift towards quality of care. Increasing institutional deliveries means little if the care provided is unsafe or disrespectful. Reports of neglect, abuse, and lack of privacy during childbirth highlight the urgent need for respectful maternity care. Quality must be defined not only in technical terms, but also in terms of the experience of care and client satisfaction. Future RCH programs should prioritize quality standards, supportive supervision, and patient feedback as central measures of success. Primary health care remains the cornerstone of equitable service delivery. Strengthening primary health centers is critical for the future of RCH. They must provide comprehensive services, including maternal, newborn, child, and adolescent health, along with nutrition and mental health. The Ayushman Bharat initiative has emphasized transforming PHCs into health and wellness centers. Integrating RCH into this vision ensures that families receive holistic, continuous care close to their homes. A strong primary health care system is the most cost effective and equitable pathway to better reproductive and child health. The future of RCH lies in integration rather than fragmentation. Instead of multiple vertical programs operating independently, services must converge to address the holistic need of families. Maternal health must link with nutrition interventions. Child health must connect with sanitation and clean water efforts. Adolescent health must align with education. Integrated service delivery not only reduces duplication but also improves effectiveness. Families experience health as a whole, not in compartments, and programs must reflect this reality. Integration is therefore both logical and necessary. Adequate and sustainable financing is essential for the future of RCH. Current investments remain insufficient relative to the scale of need. Increasing public investment is critical to strengthen infrastructure, human resources, and service quality. Innovative financing models such as performance based financing or strategic purchasing may offer additional resource. At the same time, protecting families from catastrophic health expenditures through insurance schemes and free services remain essential. Future directions must ensure that no mother or child is denied care due to financial barriers. Public private partnerships will continue to play a role in the future of RCH. The private sector already provides a significant share of maternal and child health services, especially in urban areas. Partnerships can expand access, bring in innovations, and leverage resources. However, they must be carefully regulated to ensure equity and equality, avoiding exploitation or widening inequalities. Models like Chiranjeevi Yojana of Gujarat illustrate both opportunities and challenges. Future collaborations should emphasize shared goals, transparent contracts, and strong accountability mechanisms. Community participation will remain central to the sustainability of RCH programs. Strengthening platforms such as village health committees, self help groups, and youth clubs ensures that communities have a voice in planning and monitoring services. Social accountability tools like community scorecards and public hearings promote transparency and responsiveness. Empowered communities also build trust in health systems, increasing service uptake. The future of RCH depends not only on strong systems but also an active citizen engagement that makes services people centered and accountable. Innovations in service delivery will shape the future of RCH. Task shifting to trained mid level providers can help address human resource shortages. Mobile clinics and outreach services can reach remote and underserved populations. Home based care models, especially for newborns and postpartum mothers, improve survival and strengthen family support. These innovations must be adapted to local contexts and backed by training and supervision. They represent practical solutions to bridging persistent gaps in access and quality, particularly for vulnerable populations. Future directions in RCH are also shaped by global health priorities. The Sustainable Development Goals provide targets for maternal and child mortality reduction, family planning, access to healthcare, and universal health coverage. The push of universal health coverage emphasizes equity and financial protection. Global financing mechanisms such as Global Financing Facility are supporting countries to strengthen their RCH systems. Aligning the national programs with these global agendas ensures coherent sustainability and access to international resources. The future of RCH must therefore be envisioned both nationally and globally. The future of RCH must be evidence driven. Operational research is needed to identify what works in real world settings and to adapt strategies accordingly. Innovations in evaluation, including mixed method approaches and participatory research, can capture both numbers and experiences. Data driven decision making should become the norm, with program managers regularly using evidence to improve performance. Building a culture of research and learning within health systems is critical. This ensures that RCH programs remain dynamic and responsive to emerging challenges and opportunities. A capable and motivated health workforce is central to future of RCH. Capacity building must go beyond technical skills to include new competencies such as digital literacy, data analysis, and community engagement. Leadership development at all levels is essential to drive reforms and innovations. Building resilience in the health workforce means preparing providers to adapt to crises like pandemics or natural disasters while maintaining essential services. Investing in people is as important as investing in the infrastructure. For without a strong workforce, programs cannot succeed. The COVID 19 pandemic, we all remember it, highlighted the vulnerability of RCH services during crisis. Many and women and children were unable to access routine care due to lockdowns, fear, or overwhelmed facilities. Future directions must ensure that essential RCH services are protected and reach everybody in need during such type of emergencies. This requires resilient systems with backup supply chains, flexible workforce deployment, and clear communication strategies. Strengthening emergency preparedness ensures that maternal and child health does not suffer disproportionately in future pandemics or disasters. Building resilience is now an indispensable part of RCH planning. Emerging infectious diseases pose new risks for reproductive and child health. Viruses such as Zika can cause severe congenital anomalies, while outbreaks of Ebola have shown disproportionate impacts on maternal mortality. With increasing globalization and environmental change, new pathogens will continue to emerge. RCH programs must therefore be integrated with disease surveillance systems, therefore ensuring that maternal and child health needs are addressed in outbreak responses. Rapid response capabilities and cross sector collaboration are essential to safeguard mothers and children against the future threats. Nutrition remains a cornerstone of maternal and child health, but the future presents a double burden. Undernutrition, anemia, and stunting still affects millions of children and women, limiting survival and development. At the same time, overweight and obesity are rising in urban and wealthier populations, creating risks of non communicable diseases such as diabetes and cardiovascular diseases. Integrated nutrition strategies must therefore tackle both undernutrition and overnutrition. Linking health services with food systems, agriculture, and education will be key to addressing this complex and evolving challenge. Civil society organizations and NGOs will continue to play an important role in the future of RCH. They often reach marginalized populations that government systems struggle to reach. They also advocate for right based approaches, ensuring that the voices of women, adolescents, and vulnerable populations are heard in policy processes. NGOs frequently pilot innovative approaches at the community level, which can later be scaled up by government programs. Strengthening partnerships with civil society enhances both reach and accountability in RCH service delivery. The future of RCH will bring new ethical and legal challenges. Upholding reproductive rights, including the right to safe abortion and informed choice in family planning, remains a priority. Consent and confidentiality are especially important in adolescent services, where fear of disclosure can deter utilization. The expansion of assisted reproductive technologies and genetic interventions raises new ethical questions around access, affordability, and regulation. Policymakers must anticipate and address these issues proactively to ensure that technological progress aligns with ethical principles and human rights. Future RCH policies must be aligned with the vision of universal health coverage, ensuring access to essential services for all without financial hardship. A life course approach is needed, addressing health needs from adolescence through reproductive years to aging. Equity and inclusiveness must be placed at the core so that progress benefits the most disadvantaged first. These policy directions reflect a shift from narrow program focus to comprehensive, integrated health system strengthening. They provide a roadmap for ensuring sustainable and equitable improvements in reproductive and child health. To summarize, the future of RCH will be shaped by demographic transitions, rising non communicable diseases, climate change, urbanization, and technological advances. Emerging issues such as adolescent health, infertility, mental health, and nutrition demand greater attention. Innovations in service delivery, financing, and community participation will be the key. Building resilience against pandemics and emerging new diseases is essential. Above all, equity, quality, and participation must guide every step. Only with these priorities can reproductive and child health programs evolve to meet the needs of tomorrow's mothers, children, and families. In conclusion, the future of reproductive and child health will be defined by how well we adopt to emerging challenges and opportunities. Resilient systems that can withstand shocks, inclusive approaches that reach the most marginalized, and people centered services that respect dignity and rights must guide our path. As we close this module, remember that RCH is not static, it is dynamic, evolving with society and the world around us. The task before future health professionals and policymakers is to anticipate this change, embrace innovation, and remain committed to equity and compassion. By doing so, we can make the vision of health for all a reality in the years to come.